Probably the worst part about being sick is the cough. I mean, the fever, the sneeze, the lethargy, they aren't a pleasure either, but they don't nag at you or disrupt your sleep or alert everybody else that you're a fountain of infection the way a cough does. And the constant coughing is what makes pertussis such an awful disease. Though you probably know pertussis as whooping cough.
In older individuals who have some protection, some vaccination, it is just a extremely annoying, typically 100-day illness. So 100 days of severe cough, and usually during that phase of illness, you'll actually have a period where you're coughing so much, you have many sleepless nights, will often cough to the point of vomiting, cough to the point of actually having bleeding in the nose or blood into the white of the eye because you've coughed so vigorously. And adults who've had this illness will definitely remember having had this illness. It's one of the worst coughs around.
Whooping cough is an infection caused by bacteria called Bordetella pertussis. Now, the infection itself only lasts several weeks, but it's the body's severe inflammatory response in the form of increased mucus production and the swelling of the respiratory tissues that causes those 100 days of cough. Now, we do have a vaccination against pertussis, but the resulting immunity only lasts for about 10 years.
But now we've added a component for pertussis or whooping cough, which we used to think was just a childhood problem. But actually the majority of cases of whooping cough occur in older individuals because the 5 vaccines you got as a child between 2 months and 5 years of age, the immunity from that wanes over time. Even the immunity from natural infection apparently wanes over time. And so the further away you get from those vaccines or from that infection, the more of a chance that you're again susceptible. And so the current approach from the CDC is that all children entering middle school, and in fact by law in New York State, all children entering 6th grade have to get a tetanus and pertussis vaccine, not just a tetanus shot.
It's recommended that young adults going to college also get another pertussis vaccine, as we've seen major outbreaks on college campuses. But we don't recommend this vaccination just to save these adults from coughing through a final exam. Whooping cough in infants is a potentially fatal disease. And one way to protect babies is by making sure people such as young parents, nannies, or babysitters don't pass the infection on to them.
It was shown in these school outbreaks that from these middle school and high school outbreaks, there were then extensions to infants that then led to infant mortality. And like I said, we've done the best we can in protecting kids by vaccinating themselves, and now we have to use more of an umbrella approach and try to protect them from their teenage and young adult exposures. It's been shown that children that have pertussis, especially infants that have pertussis, at least in 30% of them you can identify that mom and or dad also have pertussis. That's how the child got sick. And so the other recommendation is that all young parents also get pertussis. In fact, it's the goal of many of us that pertussis, the tetanus pertussis vaccine, the Tdap, will become a routine postpartum vaccine so that young moms will have protection against this infection and therefore protect their babies until their babies are completely immunized. And you don't have complete immunity until you've gotten your booster vaccine in the 2nd year of life.
Early in the illness, antibiotics can reduce the severity of the symptoms. But unfortunately, early in the illness is when the symptoms are the most mild, and most people miss that window for antibiotics. That's why a prevention approach, meaning the pertussis vaccine, is far more effective. I'm Dr. Keller-Wortham, and you're watching the eHealth Network. And if you're coughing right now, cover your mouth.